Yeah. Okay, we are audible to everyone. Are we audible? Just put a thumbs up in the chat if we are audible. And we will be starting the meeting in 2-3 minutes. Thank you for letting us know that we are audible. Okay, we will just start within 2 minutes, waiting for people to join in. Till then, please share the links to all the beautiful women that you know of your life. This is a very, very interesting session, and I feel that every female should be aware of this. So please, if you can share it to your all your known ones, your mother, your sister, your cousin, your friend, your wife, your daughter, anyone, any female, or to the males, so that they are aware and they can share it to the females of the family. Please, please share this so that we can start it with the more audience, and we try to make people aware of this condition, which is really, really rarely talked about. So I see people joining in, and my again a small request, please share it to all your known ones so that we can reach maximum people. This will also be posted on our YouTube channel. So you can, if not now, you can always rewatch it later. But if you have any doubt, this is a live session just because we can connect with each other and you can ask us any doubts that you have. Good evening to everyone. So a very good evening to everyone. I'm not sure if you know me or if you know Dr. Bhushan. So let me give you a smallest intro as possible. Myself, Dr. Raminder Kaur, a cardiopulmonary therapist, a physiotherapist specialized in cardiopulmonary, to be on a simpler words. I have started this live series of talking with the doctors and getting you know about the conditions that are rarely talked about. And also in the time of this pandemic where everyone is focusing on COVID, there are health conditions which are totally sidelined but are very, very important to know. So today we have Dr. Bhushan Bhalgat. He's, I guess most of you know him. He's such a good friend. We are like childhood friends. And I'm happy that he accepted my invite to join this live series. And I welcome Dr. Bhushan Bhalgat. He's completed his MBBS, MS, and he's now an onco resident. So he'll be throwing light on cervical cancers and what all we should know. So I welcome you, Dr. Bhushan. Over to you.
Thank you, Raminder. So should I share my screen?
Before that, let us first, I have a few things that when I posted it on Insta, like if you want to know about cervical cancer, or if you, what do you know about cervical cancer? There were few myths, there were few questions, there were few doubts. and people were totally blinded what exactly it is. So I would like to ask 2-3 questions regarding that, and then you can take it over. So very fastly, we will try to clear few myths. First myth goes as, is it very common in elderly women? Is it true? It only happens to the elderly?
No, it's absolutely not true. Like
Okay.
the most common age group we can say is starts from around 35, 40 years age, and it can extend up to 65 to 70. So it's
Okay. So
not a
almost
cancer of old
everyone
age.
should be aware of it, according to you.
Yes.
Yes. So is there like a female with cervical cancer can never become a mom? Is it true?
Not that way. If you diagnose cervical cancer in an early stage, definitely fertility issues are not a concern. But yes, if it's a bit advanced stage, uh, childbearing will be an issue that
Okay.
has to be discussed.
It has to be discussed. Okay, so we will talk a little detailed and at with the presentation that Dr. Bhushan has prepared for all of us. One last thing, is there a vaccine for it? I am aware
Yes.
because I have taken it, but what is your point of view? Like, should this be as normal as everyone should take? Like we give vaccines to children, should this not be as important as explaining everyone that the vaccines are available for it? So, what is your take on this?
The importance of vaccine already everyone knows since Corona has come. The
True.
COVID-19 vaccine has come. So no doubt there are many other things which need vaccines, and cervical cancer is definitely one of them. And we should at least vaccinate all the female members in our complete family.
Okay. Is there any age limitation for the vaccination?
Yes, I'll tell in detail also, but yes, it's starting from 21 years of age. Uh, you can start around 20. I mean to say just before your marriage, you should get vaccinated. Basically,
Before any sexual activity, you mean to say?
yes,
Okay.
yes.
Okay. So I hand over to you this session, and I am sure you're going to rock it. You're going to tell every detail about cervical cancer. I will keep on disturbing you in between, and please don't mind for that. And let's just move on with your session.
Yeah, thank you. I'll share my screen now.
Yeah, please.
Is my screen visible?
Yes.
And now full screen, is it visible?
Yes, it's totally visible.
And
You
I'm
don't worry
loud and
about
clear.
people entering. I will admit them. So you just
Okay.
continue with it.
And I'm loud and clear.
Yes, you're very loud and clear, doctor.
Yeah. So let's start. First of all, good evening to all of you, and thank you for joining. And today we are going to talk about cervical cancer. There are many cancers in this world which occur to many people around us, and we think, yeah, it happened to him, it happened to her. Why will it happen to me? It may happen to me in old age, but why should I worry about it right now? So, but you should remember that there are a few cancers which can be prevented from happening even in the old age or in the middle age. And cervical cancer is one of these. So it is known as one of the preventable cancers. We have vaccines. It is preventable. Remember that. So let me start. Yeah. These questions, we had taken a survey, me and Dr. Raminder, and we came to know that the people are having these questions in their mind when they think about cervical cancer. Like, why should I attend this talk? Why will this occur to me? Why will I be affected? Then some people asked, Doctor, where is the cervix? What do you mean by cervix? What do you mean by cervical cancer?
True. I got messages that is it related to the neck? So yeah, cervical in medical terms has two different things. It is not neck. It is a female organ, which we are going to talk about.
Yes. Cervix, I'll tell in detail. Cervix also means the neck and the organ near the uterus. Definitely. Then the other question which came was, how will I know that I may be suffering from it? Should I remain quiet before telling my relatives that I am having symptoms? Then how to detect this early? If at all I am having it, how will I know? Then how will I prevent it? What do you mean by HPV vaccine? What are the types? When should I take it? What are the treatment options do I have if I have cervical cancer? If I have HPV infection, what are the treatment options do I have? And the maximum people ask this, if I have this cancer, how long will I be able to live after I have this cancer? So one by one, let's take on all these questions. So first of all, about the statistics. Among all the cervical cancers occurring in this world, 23% of the cancers, of the cervical cancers occur in India. India is known as a low middle income country and a high population country. In this country, the rate of infections is very high compared to the world. And as I will say further, cervical cancer, one of the most common cause is human papilloma virus infection. So infection is a cause of this cancer, and that is why such a number of cases occur in India among the world, the percentage.
Sorry to disturb you again. There was one more question. Is HPV the only reason for this cancer? Could there be any other reasons?
Yes, there are definitely different reasons. And among those, I'll discuss in detail the causes. HPV is definitely the most common of them. Yes. So talking about the age group, like I already said, it is not a cancer of the old age. It occurs in the middle age as well as the old age. So all women should be aware of it. And the maximum incidence of this cancer occurs in 40 to 55 years of age group.
Near to the menopause?
Yes, you can say that in the perimenopausal region, but starting even at 35 to 40 years of age. And 1 in 50 Indian women will develop cervical cancer, and this is very alarming. Like, for example, right now, around 25 to 30 people are attending us on Zoom, and maybe around 25 to 30 are attending on YouTube. So definitely, maybe one of these may get cervical cancer. And this is really, really alarming, and we should take care of this. This statistics is alarming. So what all are the causes of cervical cancer? Taking contraceptives for a long time. Like, for example, we can say diethylstilbestrol is one of the contraceptives which was taken earlier. Nowadays, there are better contraceptives available. But yes, these contraceptives, even these, which are the new ones, if they are taken for a long time, they are also a cause of cervical cancer.
True.
The second
And
cause,
this is a very important point to remember. If anyone is taking a contraceptive, do connect to your gynec. Do not take medications on your own. So there are consequences of medications taking on your own. One of this is told by the Dr. Bhushan.
Yes. Taking contraceptives, although in the reverse way is not harmful, you should not worry that, oh God, I'm taking contraceptives. Yes, but if you are taking contraceptives for a long time, you should communicate with your gynecologist and take advice. The second cause of cervical cancer is unhealthy lifestyle and diet. So definitely this is one of the cause for many cancers, and this is also a cause of cervical cancer too.
Like the packaged foods, the fat, specifically in the time of COVID, where we all are at home, we are more into binge eating rather than binge watching or binge studying. So we all were totally into the packaged food. So please avoid unhealthy foods. Like you can have anything that is freshly homemade. You can even have fried items, but homemade, not anything that is packaged. It contains preservatives. It contains a lot amount of salt and a lot of amount of sugars. Am I right?
Yes. Very elaborate. Yeah. And the very important cause of cervical cancer is having several sexual relationships. This is not a problem in India, but in other countries, people before marriage have several sexual relationships, and that is the cause of causing human papilloma virus infection, spreading from one person to other and leading to cervical cancer in the long term. But we should also take care of this in India too. Um, yes.
We
And
never know.
yeah, we never know.
It's a
And the
personal
next,
choice. It's okay. So we don't judge anyone, but we just want you to be aware. If this is
yes.
the case, you need to be aware. There's no judging happening here.
Yeah. And also the other way around, even if someone is human papilloma virus test positive, which I'll discuss further, does not mean that your partner is cheating. This is very important because there are various other ways of acquiring the human papilloma virus, and it's not only just having sex with other people, that is having a polygamous relationship is not the only cause. The other cause is smoking. Not in India, not so common in females in India, but yes, if smoking is it's present in our society, it is a risk factor for that person definitely.
Again, passive smoking could be one of the reason. If your
Yes,
partner or if anyone in your neighbor, if your workplace, anyone is smoking, passive smoking is as harmful as active smoking. So do not take it lightly. Anyone who's smoking in front of you, please be very sure to say it's okay. I'm not comfortable with it. Start speaking up.
yes. And coming to the last cause, not the last, but the two last causes or the most common causes, the human papilloma virus, that is the infection, and the other sexually transmitted infections. Why the other sexually transmitted infections I'm talking about? It's not because they cause cervical cancer, but the tendency of a person who has a sexually transmitted infection also has a tendency to acquire human papilloma virus infection. So that is why the HPV virus and the other sexually transmitted infection are a cause of cervical cancer. 70% in fact of the cervical cancers are due to this virus. Definitely the family tree, all these causes were the environmental causes. But what is in your family? If you inherit the cancer from your family, uh, we cannot uh, we cannot stop it. We cannot prevent it.
So there was a question, is it genetic? We sort it out here. It
Yes,
could be.
it could be. This slide also says that either from the family, if you get from your parents or grandparents, or if you do not get from your parents, if there is some malformation in your own gene, that can also lead to cervical cancer. And last but not the least, we have discussed the other causes like HPV, having multiple sexual partners, but lack of awareness is the cause of cervical cancer because of the lack of awareness of the vaccine we have for this cancer.
True.
This is very
I
important.
remember when I took a vaccine, I being a medico, there were many of my friends who were still unaware that there's a vaccine for this. So yes, there are doses, first dose, second dose, you have to take that. So please try to aware as many people as you know, all the female members of your family, the girls who have just started menstruating, do not think that they're very small. So let everybody be vaccinated for same.
Yes. So the next question was, what do you mean by cervix? Cervix, as Dr. Raminder already said, there is it's also known as the neck of our body. The other name is cervix. Like you can see in this diagram, there are various organs of the female genital system, one of which is cervix. I've highlighted here. The others are the uterus, which consists of endometrium, the vagina, the ovary, and the fallopian tubes. And cervix is one of them. This is the cervix which we are talking about, and this is the cervical cancer which we are talking about. Now, how will you know that you have cancer? What are the symptoms of cervical cancer? When should you go to a doctor? Which symptoms should alarm you that you should now go to the hospital? Blood spots or light bleeding between or following periods, bleeding after having sex, after douching, or after pelvic examination. This is done by doctor. So after doing an examination, if there is bleeding, it's worrisome. Then unexplained or persistent pelvic and or back pain, the menstrual bleeding that is longer and heavier than usual, bleeding after menopause, that is when the menses stop, is known as menopause. So when there is bleeding after menopause, one of the causes is cervical cancer. Pain during sexual intercourse or bleeding during sexual intercourse, these two are also important alarming signs. Increased vaginal discharge. By discharge, I mean the white or the pseudosanguinous, I mean the non-colored discharge, which is foul smelling, can also be an alarming sign that you have cervical cancer. By these signs and symptoms, I do not mean that if you have these signs and symptoms, you have cervical cancer, but these and signs and symptoms, they help towards a diagnosis of cervical cancer, if any. So this
I
is not
also,
directly, yeah.
no, please.
So this does not directly mean that you have cervical cancer, but these symptoms should alarm you to reach the doctor and make other examination and other tests to rule out the cancer.
True. So there are chances of having a unexplained persistent pelvic or back pain due to constipation. There could be pelvic floor weakness. It could be prolapse. There are many, many other signs. And when we say there is increased vaginal discharge, it could also be just a UTI. It could not be always cancer. So these signs, whatever Dr. Bhushan has told us, these are just alarming signs. Keep a watch on it for a month and two. And if again he'll be letting you know about the further things, and do not directly jump into, because when you open a Google and you search for this symptom, the first thing will come is cancer. So that we are not trying to scare you. We are not trying to tell you ki, acha, you have the symptoms and you have cancer. So these are few of the symptoms, and there are differential diagnoses for these conditions. So it is not always, but yes, it is alarming.
Yeah. Other than these symptoms, which are local symptoms, we can have loss of weight, loss of appetite. By loss of appetite, I mean aversion to food. That means you do not feel like eating. And loss of weight can be more than 5 to 10% in 6 months. Should be alarming sign that you have some other cancer in the body or some other pathology in the body which is causing such alarming loss of weight. So not just loss of weight, 5 to 10% of loss of weight in a 6-month period.
These are the points we should be worried if you have the before symptoms. If along with this, then you might be a suspected for cancer.
Yes. Now, what to do if the patient or if the female has these symptoms? She should not be shy. Immediately, she should tell her husband, her in-laws, her relatives, and immediately she should consult a doctor. This is very important because in our setting, in the Indian setting, this is the main cause of a delayed diagnosis of any cancer in the genital region, in females especially, and even penile cancer in males. So you should not be shy and immediately confront a doctor.
Talk to whoever you feel is closest to you and you're comfortable with. There's no need to tell it to everyone. One person, if you're not comfortable talking to anyone, go and meet your doctor. We are here. There are medicos trying to help you. So please don't be shy.
Yeah. Now what next? What options do we have? Now everything is okay. Now I know about cervical cancer. I know about going to a doctor if I have the symptoms. I'm not shy. But now what should I do? What should I do for my family members and what should I do? So 2 things you should remember in this whole PPT. If you do not remember anything, you remember these 2 things. This PPT is enough that you have attended. One is screening and the second is vaccination. So we'll see one by one what these 2 mean and how these should be done. So first of all, the question, why should I be screened for HPV? Because like I already said, the major cause, the most common cause of cervical cancer is HPV, human papillomavirus infection. That is why you should be screened for HPV, because HPV occurs early in the stage of life. Like for example, when you start having sexual intercourse, like around the age of average around 25, Indian women get married and start having intercourse. Some before that, some after that, some before marriage, some after marriage. But once you start having intercourse, that is the time you acquire HPV infection. And that is the time you should start screening for it. Because this HPV converts to cervical cancer in the old age, but you get this infection very early in the life. So this is for my medical friends, if any listening to me. How do we test for cervical cancer if a patient comes to you? Basically, we do a pap smear. What is a pap smear? Everybody knows in the COVID-19 era now, almost everybody has undergone this test. They put a spatula or a swab through your nose or your mouth, and they take a swab from your pharynx. The pap smear is similar. This is just through the vagina, and they take a smear of the cervix. So after taking a pap smear, the cells are taken and put on a slide, after which you do 2 tests. It can be a pap test or it can be a HPV test. These 2 tests are important. Pap test is basically seen under microscope. The cells are seen directly. And a HPV test, this test is for the DNA. So from the cells which are taken from the cervix, you see the DNA under the electron microscope or the microscope, and you get the HPV test. Other than these two tests, we also have VIA and VILI. If you do not have the setting of PAP test or HPV test, at least you have a dilute vinegar. Vinegar is present almost in every house, but this specific percentage, 3 to 5% dilute vinegar or dilute acetic acid is used for VIA. And if any medicals, yeah.
Yeah, this is only for the medicos. Do not
Yes,
try
yes.
this at home. Do not try to do anything at home. This is only for the medicos attending this webinar.
Yes, yes. So either acetic acid or luvalcidine can be used, and interested medicos can take a screenshot of this slide and read it in detail. So now when to do this test? Now suppose there is a female which is 25-year-old and she's just married. She has not taken a vaccine and she's asking, when should I do this test? So what does the Indian guideline say? The Indian Association of Pediatrics, they have said to start the screening between 21 to 59 years of age, start at 21 and you should stop at 60. But before stopping, you should know that the pap smears, at least 3 pap smears are negative. Only then you should stop. So what do they say? How often should you do this test? For 21 to 29-year-old people, the pap test should be done every 3 years, and between 30 to 65 years old, if the pap test is not negative at 59, you should continue up to 65. This is a recommendation. So between 30 to 65, what you should do is pap test and HPV test together every 5 years. And if you're doing only pap test, you should do it every 3 yearly. So you should visit every 3 year or every 5 year at least and do this tests at the clinic.
So those who have taken vaccine should also be doing this test, or those who have not taken vaccine, only they should take this test?
Yeah, I've covered the 3 specific conditions. If in these recommendations, which should do or should not do the screening, I'll tell it one by one in the slides. So should you stop screening after hysterectomy? The first question, what do you mean by hysterectomy for the public? Hysterectomy means removal of the uterus. That is, in Hindi we can say bachchedani ko nikal dena. A very common operation, as common as we see, not very rare. Like appendicitis occurs almost every alternate house. Somebody has it. Similarly, hysterectomy in old females we have seen very commonly. But in some cases, hysterectomy has to be done in a middle age or an early age also. So what should they do? Should they stop screening after hysterectomy? The answer is no, because even if the cervix is removed at the time of hysterectomy, cervical cells can still be present at the top of vagina, and hence you should continue to have screening for at least 20 years after hysterectomy.
Even if it is negative for the first time, but you should still continue screening yourself every 3 years.
Yes, every 3 to 5 years, whichever test you are doing, you should continue. The second important question which Dr. Raminder right now asked is, if I have taken the vaccine, should I stop screening? So the answer is clear-cut no, because the HPV vaccine does not protect against all types of HPV that can cause cancer. Hence, women who have been vaccinated against HPV still need to follow these guideline recommendations, and they should keep screening every 3 to 5 yearly. So this is very important to remember, that once you are vaccinated does not mean that you will never get HPV, you will never get cervical cancer. Same as COVID. Once you get a vaccine does not mean that you will not be affected by COVID. Yeah, it's not due to the efficiency of the vaccine, because the vaccine is very efficient. Both the vaccines which I will discuss further are efficient, but it's because they do not cover all the HPV strains. There are around 100 strains of HPV, out of which around 15 are a high risk for cervical cancer, of which strain 16 and 18. For my medical friends who are listening, 16 and 18 are the 2 strains which are important to cause cervical cancer. One of the vaccine helps in not only preventing from these 16 and 18, but also 6, 11, 16 and 18. And one of them helps only for 16 and 18. I will tell that in next few slides. But you should remember that you should not stop screening after getting vaccinated for HPV.
This is a very insightful session, Dr. Bhushan. I am happy that we chose this topic, and I hope that even one single female gets better with this or gets educated with this. We have reached a goal.
Yeah. So now the next question, why should I screen if I'm not married? Suppose a female is unmarried up to 29 or 30 years of age. She may say the recommendations are from 21 years of age. Why should I screen if I'm not married? In this screening, we should remember that HPV is the major cause of cervical cancer, but not the only one cause of cervical cancer. And you should also remember that only having sexual intercourse is not the only cause of having HPV infections. There are other proposed causes of having HPV infection, like you can have fomite transmission, not yet so much proven, but yes, fomite transmission. Non-sexual genital contact can also cause human papillomavirus infection. So just not being married or not having a sexual intercourse does not mean that you cannot acquire HPV. So what if my screening test comes out to be positive? Should I be worried? This is a very important question because if the screening test comes out to be positive, you should be worried because you have HPV infections and you will need a few more tests to see if you carry high-grade cells, which may convert to cancer in a few years. So yes, the other tests should be done and you should not neglect the report.
So, excuse me. So we will be taking all the questions at the end of the session. Please type in. We will get back to you, everyone.
Yeah. So the second point is vaccination. One was screening, and the second is vaccination. What are the types of vaccine we have? Like you can see on the screen, there are Gardasil and there is Cervarix. So as you can see here on the box of Gardasil, there is written 6, 11, 16, and 18. So like I said, out of the various strains of HPV, we have two important strains, 16 and 18, which cause cancer, and we have 6 and 11, which cause other anogenital. Anogenital, I mean, by anogenital, I mean near the anus or near the genital area of the female and the males. Not only the females, the males also. These HPV can cause non-cancerous conditions. So these 4 strains are really important. And in Cervarix, we have only 16 and 18. So I would recommend if you are taking a vaccine, do take a Gardasil vaccine because it is more effective for other strains also. The effectiveness for 16 and 18 is similar for Cervarix, but it does not against other strains of HPV. Also, I would like to tell that in other countries like Australia, Gardasil is used for males also because HPV infection is a cause of cancer of the penis in males. Hence, this vaccine is used there in males also, but in India, it's yet not recommended for males.
Only so if I knew it before, I would have gone for Gardasil. Okay. So I have taken Cervarix, but yeah, something is better than nothing. So please be educated. Share this to all the females of your house, to all the females who are close ones, friends, neighbors, colleagues, anyone. Please do share this. This is such an important thing that we are discussing today and really less talked about.
So what is the schedule? When should I take this vaccine? It's very important. It's not just a single dose vaccine. Just like COVID, you should take 2 vaccines. Similarly for HPV, at least 2 doses if you are in the age group of 9 to 14. Now we come to the very important point, the age group of taking vaccines. You will be surprised that vaccine should be given from 9 to 14 years of age is most efficient. And if you cannot give in this age group, you can give from 15 to 45 years of age. So it's not that cervical cancer or any cancer is a cancer of the old age group, but prevention starts from an early age. Yeah. So Cervarix and Gardasil, both of these vaccines, if you are giving between 9 to 14 years, if you are giving it today, then you have to give 6 months after the first dose. And if you are giving in 15 to 45-year-old females, if you are giving it today, you have to give 1 month after the first dose and 6 months after the first dose. So there's a 5 month gap in between the first and the second, in the second and the third dose. And if you're giving Gardasil, that is the against the four strains, then if you take it today, you should give a 2 month gap and then a 4 month gap and take 3 doses. Only after 3 doses, you are very completely prevented from having HPV. So what are the treatment options we have? This I have not covered in detail because this talk was basically for the general public and not for the medicos specifically. But even the general public should know what are the options they have if they acquire cervical cancer. So the early cancers, surgery and radiation therapy, both are the options. For advanced cancer, radiation therapy with or without chemotherapy is the option. And for very advanced cancers, that is the metastatic cancers have spread to other parts of the body, chemotherapy is the option. And one more thing for HPV, the treatment for HPV, this is important, but I have not put in the slide. For HPV, if you acquire HPV, does not mean that you will now have to take antibiotics or antivirals specifically, because HPV gets treated on its own within 1 to 2 years. But it should be a worrisome feature if the HPV infection is persistent even after 1 to 2 years. That is when you should be worried.
So, but it doesn't mean that you don't get screened even if you're positive for HPV. So stating that let's wait for 2 years. So don't do that mistake. So we are just trying to help you in a straight way. We are trying to tell you all the things, but it really doesn't mean that if you're positive with the HPV, that okay, it will get better on its own. No, it doesn't.
Yeah, once you're positive on HPV on the Pap tests, then you should go ahead with the further tests. Like I won't go in detail, but like conization, LEAP, and you should get tested whether you have abnormal cells or a ingrowing cancer already in the cervix. So the very important question next, a patient with cervical cancer will ask, how long will I live?
There are various this question. Is it so fatal? Will I die? The first thing is, if I have cancer, will I die?
Yeah, that is very important. But now, since we have various modalities, multimodality approach is used for treating various cancers, the life expectancy has definitely increased. Initially, before a few decades, we didn't have anything except radical surgeries like removing the complete organ. We now have chemotherapy and radiation therapy and improved techniques of surgery to increase the life expectancy of the patients. So before answering the question of how long will you live if you have cervical cancer, I would like to tell you what are the percentage of cervical cancer by stage we have. So we do not have very strong data in India, but this is the international data from the CDC website. So this says that 44% of the cervical cancers are localized cancer. By localized, I mean just remaining up to the cervix. 36% have spread beyond the cervix, but they are in the genital region only. That is in the pelvic region only. 16% have distant cancer. That means it has spread in the other parts of the body. And they do not have data for 4% of the patients. So stage-wise, this is not exactly the stage 1, 2, 3, 4, but this is staged as localized, regional, and distant for the sake of audience we have. So for localized cancer, if you have localized cancer, you can see this data is very confusing, but I have made easy by highlighting a few points. Like if you have a localized cervical cancer, then definitely you have a chance that 87% of the people are going to live more than 10 years. If you have a regional cancer, that is a cervical cancer spread to the other local organs in the pelvis itself, 50% of the patients will live for 10 years. If you have a spread in the other parts of the body, you have that only 13% will live for 10 years. And we do not have strong data for the unstaged patients. And to make it easy, if you ask me whether I will live for 5 years or not. So I will say that if you have a localized cancer, there's a 91% chance that you will live up to 5 years. If you have a regional cancer, there's a 58% chance that you will live for 5 years. And if you have a distant cancer, the distant cervical cancer, you have a chance that you will live for 16% chance that you will live for 5 years. So basically, these were the the stage-wise classification for how long will you live. But definitely for each individual, we cannot say that, yes, this individual live for this many years, but we can give a gross percentage based on the population data we have, that how many people have lived for how many years until now. So to conclude, I would like to say that HPV is preventable. HPV is the main cause of cervical cancer. HPV is a virus that we all can beat. Very important is to vaccinate yourself if you are a female. And for all the male audience who are listening, I know there are a few medical friends who are listening to me right now. You are aware of this vaccination, but I'm sure 80% of you and even me have not vaccinated the female members in our families. It's very important. So I tell you, vaccinate and keep screening. Thank you.
That was a very, very insightful session. I am sure like all the audience was like, it is an eye-opening thing that how it grows, what happens, what are the signs and symptoms, and how should we take it. See, everything has a positive side and a negative side. But as Dr. Bhushan has told, that 91% of chances are there that you will get back to normal, like it will be fine. So why not get vaccinated and screen? If you're not vaccinated, don't worry about it. Get screened. Get screened. I was aware that it's up to my knowledge. I till today I thought that only vaccination is to be taken before marriage. So after marriage you cannot. But he's told a very, very important point. There is a vaccine for 18 to 55 years of 30 to 45 years of people. So please get vaccinated. As simple as that, no?
Yeah.
So we have few questions. I request you all to switch on your videos. You can ask now. This will be an interactive thing. So first we will take the questions that are in the chat, and then if you have any other questions, we will try to set it. Okay. So we have, thank you for the good information, Doc. All thanks to you for taking up. So we have few questions. Okay. If patient is having other STDs, whether she can take vaccine to prevent HPV?
Yeah. HPV vaccine should be given to all, regardless of anything. If you are in the age group of 9 to 45, you should get vaccinated. Even if it's late, like some females who are listening are 40, 41, they may say, what's the use? If you are vaccinated before 45, there is definitely use, because cervical cancer decreases after having this vaccine. And STDs, the question about STIs, having other STIs does not mean that you cannot take HPV. HPV is totally different from other STIs, and you should get vaccinated.
True. Okay, I hope Dr. Smita, your doubt is solved. Then we have, how early should the symptoms be diagnosed? I guess as early as possible. Doctor, do you want to say something else on this?
As early, yes, immediately. If you have some symptoms, you go to the doctor and you do not stay in the home and wait for something to happen.
True. Junk food is not recommended. Understood. What is the food diet recommended? Does fibrous food or any other specific recommendations?
There is no such recommendation to prevent cervical cancer, but yeah, junk food is harmful.
Yeah. So I'll just say one simple thing. Anything that is homemade, anything that is local to you, anything that is freshly prepared and is been in your house since ages. So if your grandparents have been taking it, it is good for you to take it. My simple line on this. Okay. Can married women take vaccine?
Yes. Even
yes,
if very important. Yeah, even if you have had sexual intercourse, even if that is the case, you can take vaccine, but it is effective if you are taking before the first sexual intercourse.
Okay, thank you. What are other investigations needed or available?
Like if you have already had cervical cancer, to diagnose that cervical cancer, we have colposcopy, we have endocervical curettage, we have biopsies, we have MRI, MRI of the pelvis. These are the investigations which we should do. And if needed, a PET CT scan.
Can patient with precancerous or cancerous stage who did not got vaccinated earlier can they get vaccinated now?
Yes, a very good question. If you are in a precancerous stage, you should go ahead for other tests. Vaccination is now a past for those patients. If you have a precancer lesion, go for LEAP, go for conization, and get other tests done.
Okay. Okay, thanks to clarify on the queries. If you want, you can switch on your cameras. We would be happy to see you all. And if there are any other questions for Dr. Bhushan or for me, we will be happy to help it out. I hope this was a crisp and short session and very, very informative. I feel it was informative, so I am sure that it was informative for you all as well. And I am really thankful for all of you to take out your precious time to know about something which is really less talk about. So kudos to you to take out the time and learn about something new. Learn something new about your body, giving priority to your health. It really means a lot. It does. Any questions? I'm so happy to see you. It feels good when we are taking some efforts. There are people who are taking some time out from the busy schedule to give time for your health. It means a lot. Thank you everyone. I guess that's it, and we don't have any more questions.
Hello Raminder.
Yes.
I'm Dr. Sanjay Bhalgat.
Hello uncle, how are you doing?
I'm fine, beta. It's not because my son Bhushan is delivering a lecture on this very essential topic, but it's commendable on your part that you are conducting this series of various lectures. Last time someone spoke on osteoporosis. Now Bhushan is speaking on cervical cancer. Hats off to you, Raminder Kaur.
Thank you so
You
much.
are doing
Means
a
a lot when it
very
comes
good
from you,
job,
uncle.
very good job, and very nicely conducted lecture. God bless you, beta.
Thank you so much. Means a lot. Yes, there is someone who's raising hand. Do you want to ask? Please ask. Is there anything? We are happy to help you out. We are here to solve your doubts. Please.
Well, hello, good evening. This is Sushil Sharad. I'm unable to switch on my camera. So fine,
No
my
worries.
audio is very much audible to you, I hope so.
Yes, it is.
So it was a very wonderful and informative session for non-medicals like me and my family members here sitting. A few of my female family members are also listening to Bhushan and you. So I thank you personally from my family members and myself. Please do conduct furthermore series on different kind of cancers.
We surely will.
Yeah, and I will be looking forward to join those sessions soon.
Thank you so much. Means a lot. When we get a positive feedback, we feel good that, okay, we are doing something nice and we are trying to reach people who are totally unaware. It really means a lot for you to take out time, and it means a lot to us that you are taking out time for your health.
Yeah, thanks, Dr. Raminder. Thanks, Bhushan.
Thank you. Okay, nicely organized. Please conduct one more on depth with Dr. Bhushan regarding oncology and breast cancer.
Yeah, definitely.
So when are we doing this, Dr. Bhushan?
Whenever you have time.
I am okay. Whenever you say, I am in for it. There's nothing better than spreading awareness. Like I always say, if one person is getting some knowledge due to us, we have reached the goal. So we will surely conduct more session and see. Dr. Bhushan has told it in front of you, all of you, that he's going to do it. So I'm sure he has to do it now. So I guess that's all for the session. Again, I thank every one of you to take out time and join us, and hope to see you. Oh, there's someone. Very sorry. Yes, please say. Please say. Sandhya Desai ji, please say. You raised the hand. Do you want to say something? I guess that was just by mistake. I conclude this session and thank you so much. Thanks, Dr. Bhushan, once again. See you all. Have the best of health. Take very good care of yourself and stay happy, stay positive. Not COVID, but attitude-wise. Okay. See you.
Thank you.
Bye-bye.